we feeling in here? Totally understandable. I'm pretty sure that everybody who comes in here is very nervous before having surgery, but that's okay. We have some amazing doctors here that are going to take really great care of you, okay? So to start, I did bring you a Ziploc here, okay? This is for you to store your belongings so they stay all together. Then we do have a locker right there behind you that you can just take the key, okay? Okay, so I'm going to put this down to the side. Okay, real quick. Can you just tell me the last time you ate? Okay. And same with having anything to drink. Okay. And was that the last time you took your meds? Alright. So and then, do you have someone here who will be able to drive you home? We're gonna be keeping you probably overnight for observation. You do? Okay. Can I get their phone number? Yeah, I asked if they're here now because sometimes people like to have someone there for them in recovery. So, okay, just taking a look at our checklist here. Right. So then we put this down for a moment. Hooked up to the monitor here, and then Dr. Cozy will be coming in to do a quick exam and say hi before it's time to take you back. So. This guy just goes on your finger like so. I'm gonna put it on your right, okay? You can remove that when you're putting your stuff in this Ziploc in the locker, okay? always takes a minute. Sorry. Here you go. Document your vitals. Let me grab a quick temperature from you, okay? So it's just gonna hover right over your forehead. Okay, perfect. So I'm gonna go let Dr. Cozy know that you're ready, and she should be right in a moment, okay? Okay. All right. How are we doing in here? Looks like Tulsi got you all nice and hooked up. Good. Okay, great. And you're feeling good about today? Awesome. All right. I know it can be a little bit on the nerve-wracking side. Keep your eyes open for me, okay? Good. Excellent. Good. Okay. Real quick. Just gonna take a look at your airway, okay? So open. Beautiful. Thank you. Good. Everything looks good. How is your pain level right now? That headache you've been having? On a scale of 1 to 10, where would you rate it? Okay. Well, I'm pretty confident that after today, you should be feeling a lot better, okay? You've been dealing with this for a really long time. You definitely more than deserve some relief. Real quick, keeping your head still, I'd like you to follow my light with your eyes. Just getting a baseline here. Beautiful. Okay. And then focus on my light right here. And I'm gonna. Good. Okay. Alright. Focus on my light. Okay. Alright. Blink reflex is intact. I'm gonna listen to your chest here. Right? I know. It's a little cold, sorry. Okay. I'm gonna get you to take a deep breath in for me. Deep breath in again. And out. Deep breath in. And out. Last one. Deep breath in. And out. Excellent. Okay. Lungs sound good, nice and clear. I'm just gonna feel under your jawline. Okay. And your tummy. Just checking your kidneys. All right. Well, you're looking good, so I feel like we are very confident with proceeding, okay? Okay, so I'm going to be stepping out of here in just a moment, but do you have any questions or concerns you'd like me to address for you before we move forward? Yeah, it's pretty common to have some nerves before going through a surgical procedure, but our anesthesiologist is going to be monitoring you through the entire process, making sure that you stay stable and that you stay asleep. And I have done so many of these procedures and have a very high rate of good outcomes, so I promise you, you're in good hands. We're going to be monitoring and making sure you're okay every step of the way, alright? Okay. Well then, my dear, I am going to go and make sure that our operating room is all set up and ready for us, and I'll see you in there, alright? Okay. How are we doing? You doing okay? Okay. Good. So, I am in here first with you because I need to shave a spot on your head where we're going to be going in to clip that aneurysm for you, okay? nice scent. It's pomegranate raspberry, and it's a natural kind of shaving cream. So it's got shea butter, which is good for your skin. Okay. Your hair is pretty short here, so I don't think I need to trim it at all first, okay? So let me grab a tissue real quickly. Or the rest of the tissues. Set this extra one right there. Okay. Let me know if this is pulling at all, right? Let's take a look here. Do a little bit more just to make sure we have a good working space. Right here. Right here over here. Oh yeah. Come on in. I just finished shaving our patient. Alright. Anesthesiologist is here now, so I'm gonna move out of the way. I'm still going to be close by, just on the other side, okay? Okay. Sorry. Getting out of your way. Okay. You doing okay? Okay. So I'm gonna get your IV started, okay? And should help you feel very relaxed. Alright. Just put this right here. And I'm gonna take a look at your arm. So I'm gonna go with your left real quick here. Let me just get my stuff organized. So you're going to feel a bit of a warm, sort of flushed feeling. Which is natural. Just a piece of tape here. Just going to place this over. The other. That should be good. Grab a piece of tape. Just to make sure this stays in place when you get moved to recovery. Alright. So that should have you starting to feel pretty relaxed. You might notice your vision getting some streaks, some blurriness, and that's okay, alright? That's what's supposed to happen. So, alright. How are you feeling? You feeling okay? Those streaks, you're seeing them? Yeah. Okay. Real quick then. Get you to just keep your eyes open for me, alright? Good. Okay. I didn't like that one. I think we're ready, okay? Gonna grab a mask here. Some positions up. And I'm going to just like, hold on. Make sure this is secure here. There we go. Alright. Gonna be placing this right over your face like so. Okay. That okay? Alright. So, gonna have you count with me down from 10. Are you ready? Good. 10, 9, 7, 6, 5, 4, 3, 2, 1. Alright. Today is a good day to save lives. Okay, let's start by taking some measurements here. Alright. Start off cleaning our field here. Let's make our incision. Excellent. Chelsea, get ready to clear the field. Okay, great. Thank you. Okay. Okay. There's an opening here. That's fine. Our aneurysm here. I'm gonna get you to clear the field for me. Thank you. Alright, I see it. Now let's find the vessel that's supplying the blood here. How do I look on vitals? Vitals are looking good. Oxygen sat still at a nice and stable 98. Blood pressure's good at 110/65. Install our clip here. Chelsea, can you irrigate the field? Thank you. Alright. Alright, let's move our plane up here. Alright, clear the field one more time for me. lip here is doing its job. Everything else is clear and clean. I think we're good to go. Let's replace this. Close. Alright, so everyone did a great job today. Chelsea, can we have you bandage the patient? And then we'll get them moved over to recovery. Thanks, guys. Of course. Welcome back. Here, let me open up your IV a little bit. Feel a bit more alert. Okay. Nice and slow. Do you know your name? Good. Do you know today's date? And how about, do you know where you are? Yep. Last question. Do you know why you're here? Yes. You had an aneurysm clip installed and the procedure was successful. No issues whatsoever. So you should definitely be getting some relief. What's your pain level at right now on a scale of 0 to 10? 0, obviously not, but being absolutely no pain whatsoever. 10 being the worst pain you've ever experienced, like excruciating, you're gonna die. Okay, that's good. Throat might be a little bit on the sore side. That's okay. It's from the intubation and it'll wear off. Gonna need to hold off on any water for right now until we make sure that you're completely stable, okay? I know, but it's really important. Real quick. I do need to do an exam with you, okay? Just to make sure that you are in fact stable and your cognitive function is not impaired at all. So keep your eyes open for me. Good. Excellent. Okay. And then I want you to keep your head completely square, so don't turn your head at all. Just want you to follow my light. Good. Just with your eyes. Excellent. And then, alright, it's gonna look like I'm gonna poke you in the eye. Promise you, I won't. Just testing your blink reflex. So, good. Excellent. Good. Okay. All right. So then, grab real quick here. That was gonna fall. I do need to check your incision site real quick. Just pulling it up a little. Good. I don't see any accident or striations. It's a nice healthy pink. I'm just going to listen to your chest here. Deep breath in for me. Good. And out. Again, deep breath in. And out. Again. Good. One more deep breath in. And out. stays in the skin. Happens when oxygen is escaping from the lungs. But I'm not feeling anything. Real quick, I just want to take a look at your airway, okay? Open for me. Thank you. Okay, I'm gonna remove my tongue depressor. Can you lift up your tongue for me? Okay, good. Hey. Gonna take a quick peek. Oops. In your ear, sorry. Starting on this side, down. Everything looks nice and healthy in here. No sign of drainage or erythema in the ear canal. Okay, check the other side. Pardon me as I lean over you. Okay, this hair looks good too. No erythema, induration, or any drainage present. Nice and healthy color. Just a little bit of earwax, but that's okay. Alright. Just going to feel your skin temperature with the backs of my hands. need to keep you NPO for a while, which means no food or drink for a little bit, just until we make sure that everything is completely stable and we don't have to go back in for any reason, okay? I know, but it's really important because on the off chance that you do need to go back into surgery, we don't want to risk any kind of aspiration, so that's why, okay? It should just be a couple of hours, alright? So, in the meantime, I want you to try to rest, alright? Okay. I just need to take a few notes in here, and then I will leave and let you have complete peace in here, but just gonna chart. So, feel free to ignore me. Actually, before you completely go to sleep, are you warm enough? Okay. If you get cold at all, let me know and I will happily bring you